Hi everyone, welcome back to Dose Decoded. Let me ask you something. Have you ever looked at a medicine strip and thought, why does this tablet have such a complicated name? Or maybe you have heard students casually saying things like API, ROA, dosage form, and suddenly it sounds less like healthcare and more like a secret coding language. And then, of course, there's the classic question. Wait, pharmacists and physicians, aren't they the same thing? Well, today we are decoding all of that. By the end of this video, you will understand what pharmacy actually is, what pharmacists really do, how they differ from doctors, and some super common pharmacy terms every beginner should know. First things first, what exactly is pharmacy? Now, if you ask most people, they'll probably say, oh, pharmacy means medicines or the person at the medical store. And technically, they're not wrong, but pharmacy is so much bigger than that. Pharmacy is the science of designing, developing, preparing, testing, manufacturing, and safely using medicines. Think about it. Before a medicine reaches you, somebody has to discover it, test it, manufacture it, package it, check its quality, get regulatory approval, and transport it safely so that it finally makes it to the patients and they can use it correctly. That is a huge process, and pharmacy professionals are involved in almost every step. And honestly, medicines are kind of like celebrities. You only see the final polished version, but there's an entire team working behind the scenes to make this happen. Now, here's something interesting. A single medicine can take years to develop, sometimes more than 10 years. And even after reaching the market, medicines are continuously monitored for safety. So, pharmacy is not just about tablets. It combines science, healthcare, chemistry, biology, manufacturing, regulations, and patient care, which is why pharmacy students study such a wide variety of subjects. One day you're studying human anatomy, next day it's chemistry, then other day microbiology, then pharmacology. And if you're a pharmacy student watching this, you already know exactly what I'm talking about. Now, let's address one of the biggest misconceptions: pharmacist versus doctor. This confusion happens all the time, especially in countries where people see pharmacists in medical stores. So, let's simplify this once and for all. Doctors mainly diagnose diseases, examine patients, and decide the treatment plans. For example, a patient comes in with fever. The doctor identifies the illness and prescribes the treatment. Now, the pharmacist's expertise is different. Pharmacists are medicine specialists. So, pharmacists will understand how medicines work, the dosage and interactions involved, and finally, the storage and safe use. So, while doctors decide what treatment is needed, pharmacists help ensure the medicines are used correctly and safely. It's a teamwork, not a competition. And actually, modern healthcare success depends on collaboration. Now, another huge myth. People think pharmacists only work at pharmacies. But no, pharmacy graduates actually work in pharmaceutical companies, research labs, hospitals, clinical trials, manufacturing, regulatory affairs, quality, medical writing, and even corporate project management. So, if you are someone considering pharmacy as your career option but are worried, will I only have one career option? The answer is absolutely not. The field is actually very broad. And honestly, many students discover career paths during their course that they never knew even existed. Now comes the fun part, all the pharmacy jargons that you are likely to hear on your first day. Let's be real. The first few days in a pharmacy class can feel slightly chaotic. Everyone around you is casually throwing around terms like API and ROAs with full confidence, while you're sitting there and smiling, nodding, and internally thinking, yep, absolutely no idea about that. But don't worry, pharmacy terms just sound scary. Let's get decoding on some of these words and turn them into a normal human language. Starting with the first term, a dosage form. A dosage form simply means the physical form in which a medicine is administered. Examples include tablets, capsules, syrups, injections, creams, and many more. Now, one could think, why do we need so many dosage forms? Just be done with a tablet. But imagine giving a tiny baby a bitter tablet. Absolute chaos. That's why pediatric medicines are often syrups. Similarly, if someone is unconscious in an emergency, you obviously cannot give them a tablet to swallow. That's where injections help because they can be administered faster. So, dosage form designs are based on convenience, speed, patient condition, age, and effectiveness. The next term is route of administration or ROA. Sounds complicated, but it simply means how the medicine enters the body. That's it. Common route of administrations include oral by mouth, intravenous, which is through the veins, topical means to the skin, and inhalation through the lungs. So, if someone asks, what's the ROA of this medicine? They're basically asking, how do you take it? Fancy name, simple meaning. Now, the third term we are looking at is API or active pharmaceutical ingredient. Now, this is one of the most important terms in pharmacy. API stands for active pharmaceutical ingredient. This is the ingredient that actually produces the medicine's desired effect. Think of the API as the main character of the medicine. Everything else supports it. Example, paracetamol is used for reducing fever and pain. The next term we are looking at is an additive. Now, medicines don't only contain APIs, they also contain additives known as excipients in pharmacy lingo. Your additives help improve taste, color, texture, stability, shelf life, and overall usability. For example, that sweet taste in your cough syrup, usually an excipient. They might not be the hero, but they're still a very crucial part of your everyday formulations. Moving on to the last term, adverse drug reaction or ADR. ADR are also commonly known as side effects. The side effect is an unwanted effect caused by a medicine. Examples include drowsiness, nausea, headache, and dizziness. Now, here's something important. Having side effects does not automatically mean that the medicine is bad. Many medicines have both benefits and risks. The goal is always benefit should outweigh the risk. This is exactly why medicines should not be taken casually just because Google said so or your cousin took it once. Please, your cousin is not a chemical trial. Moving on to the last segment of this video. Pharmacy is not cool, but is it really? A lot of us enter pharmacy without fully understanding the field. But once we start learning how medicines actually work, it generally becomes fascinating. Suddenly, medicine ads make more sense, labels become more understandable, and you realize how much science really goes into patient safety. And there you go. You just learned how to tackle your first day of pharmacy. Thank you for making it to the end of this video. If this video made pharmacy feel a little less confusing, make sure to like, subscribe, and share this with a friend who thinks pharmacists and doctors do the exact same thing. And comment below what pharmacy topic we should decode next. Thanks for watching Dose Decoded, and I'll see you in the next video.